Let's talk pregnancy today. Where are all my mamas at? Where are my wannabe mamas at? I'm so excited. I have Dr. Erica Boland on today, and she's not only a friend, but she's a midwife and a chiropractor. So she's going to give us her unique perspective and answer some of the top questions that we get to help you out. So let's do this. Welcome.
Hi, thank you for having me. Good
Of
morning.
course. Good morning. Hi, all my butthole breathers out there. Welcome. We are
Okay, that
having
is
this
so
on.
helpful. I actually used that with a patient in a birth recently.
Yes, I
I was like,
know.
I love that cue. Probably the most accurate cue I've ever heard for it. So kudos.
Oh, wow. You're blowing smoke up my butt already. I like it.
No, I'm not. It's like that. And also when you want your patients to move their pelvis properly and tell them to tuck their tail between their legs, works
Yep.
every time.
Yep. And it was funny. I was at a
Still,
DNS seminar and I told Dr. Brett Winchester that I was using that. He looked at me. He's like, "You're a genius." I was like, "Well, guys have it too. Everyone
yeah,
thinks that it's girls that only have a pelvic floor. Guys
yeah,
have it too."
yeah. I
So,
appreciate it. So thank you.
well, thank you for sharing the feedback. I'm so excited to talk to you today. First of all, just because of your unique perspective, like you're not only in Cairo, so you know all that jazz, but also a midwife. And
Yeah.
this is going to be so fun. So let's talk about the question I get a lot. I don't know if you get this in your clinic with Cairo patients. Like, what is the difference between a midwife and an OB?
Oh, that's so I am a CPM. My licensure is certified professional midwife and licensed midwife, all the alphabet soup. So my licensure is for community-based birth, so home birth or birth center birth. But there are midwives in the hospital as well as OBs. So OBs are trained surgeons, and so it's typically like OB-GYN. So they're not only doing deliveries, they're also doing hysterectomies and things like that, other surgeries. And then midwives are strictly for prenatal birth and then the first 6 weeks postpartum. And then there's pretty big differences between in and out of hospital midwifery care. But in general, the midwifery model of care is like a little slower paced and a little more natural minded. But like anything, that really depends on the provider that you get, really, truly.
So, how do you know if like a midwife is the way to go for you versus OB?
I would honestly recommend everybody use a midwife unless you are a high risk pregnancy. There's for like more high risk pregnancies, there's maternal fetal medicine, MFM doctors, MFM OBs. And so that's like a whole nother category. But 80% of the time, birth does not need any intervention. 20% of the time it does, but 15 plus of that percent, it's like help. And less than 5% is like true necessary emergent intervention. So when you start with a midwife, then you're already in that thought process. Like your provider is mostly in that thought process. In the hospital, though, all of the midwives and the OBs are bound to the policies of the hospital. And that changes a lot, like a lot of things.
Yeah. I mean, like an increased C-section rate is what we're
Yeah.
seeing a lot of these days.
Yeah.
And I've had patients, I'm sure you've had too, of just, I don't even know what happened. So,
For sure.
how being doctor certified in what you're certified in, how can someone best prepare to advocate for themselves for whatever that is they want?
Hire a doula. For sure. Like do a hospital birth without a doula. And
Mm-hmm.
that isn't just the advocacy piece for birthing how you want, because birth is the ultimate surrender. There's always something that it comes up, whether it's in birth or pregnancy or postpartum, we learn what we need to out of the full experience. And so like life, we can plan all of these things. It doesn't mean it's going to go exactly how we want it to go. But as long as you've learned along the way how to advocate for yourself and ask questions and really advocate for the experience that you want, then even if you get thrown a loop, you're still in the driver's seat of your care. And a doula is there for emotional and physical support. A doula isn't medical at all. So that's the difference between a midwife and a doula.
Yeah.
And the doula does a few prenatal visits with you. They're there throughout the birth and they're constant. So like the nurses change, the midwives change shift if it's in a hospital. Your doula's there with you the whole time. So it's someone that gets to know you really, really well and can advocate for you, especially when especially in birth, when you're meant to just be in your primal brain and not making these decisions. It's ideal if you can stay in that primal brain as much as possible and let other people around you that know what you want do the thinking. But when you have other people around you doing the thinking that are also married to hospital policy, it changes the game. It doesn't mean that they're a bad provider, but it totally changes like the progression of things, I guess.
Yeah. I mean, they are bound to do what they have to do, told by the rules and for their licensure.
Right. Yeah, absolutely. And a lot of people don't realize intervention and starts during pregnancy, not just in labor and delivery. So people will think about intervention as being induced as the first intervention. Well, not really. Before that, it's like, do you want a cervical check to see how far you are dilated at 38 weeks, which doesn't really give us much information at all because you can be dilated for 5, sometimes 6 for a while, or you can be hardly dilated at all and go into labor that night.
Yeah.
So little things like that, or like the suggestions of, well, once you're 40 weeks, we're going to want to start talking about induction, or we're going to want to start like even the conversations that happen can be intervention based or not, depending on the provider. So I think it's important too to remember that you're hiring. So if you're pregnant, like you're hiring this person, they're working for you. When they're inside of the hospital system, they're also really working for the hospital, like you said, bound by liability and policy. But at the end of the day, they're working for you. So you can choose to have the same provider all through your prenatal care, but in the hospital, you're going to get who's on call. Whereas home birth or birth center, you get what you get. You do prenatal care with them. The visits are longer and much more personal. And then that's who's there for your delivery, and that's who does your postpartum care for you and for baby.
So I mean, for a new mom or a mom that's already had a kid and wants to change their experience, how does someone figure out exactly what they want? What are the steps you recommend for them to take?
Yeah, I would look where near them for a doula. And I have pretty decent amount of contacts across the US. So if you want to reach out to me and say like, hey, do you know anybody in this area? I'm happy to help with that. Additionally, there's a book that I read that kind of propelled me into advocating more for myself, because my first birth was in the hospital and it was a general shit show during labor and delivery, everything except for a C-section, and then postpartum, baby in the NICU, all this, like, it was just totally unsupported, but I was 19 and had no clue.
Right.
And so when I was pregnant with my second, I read the book Pushed by Jennifer Block, and that it totally changed my perspective. I remember, so my husband was in chiropractic school at the time when we had our first. He was just starting, and our second, he was in it. And I was actually about to start chiropractic school. I remember my mom saying to me after our first was born, oh, you're going to be one of those chiropractors' wives that has her babies at home. And I was like, hell no, I am never. So anyway, here I am.
Here you are, having babies at home and helping people have babies at home.
Yeah. So that book, then there's the book History of Childbirth in America, looking at Michel Odant's research. He's absolutely amazing. And two, we're so inundated by social media right now. Make sure that the stuff that you're following is supportive of your desired experience, right? There's no right or wrong as long as you actually know true informed consent, which is rare. But whatever works best for you and the experience that you desire, follow people that are in that same thinking process. And like, ideally, that's not fear-based information coming into you. And because once you tell people you're pregnant already, it's like this, I don't know, free pass for them to tell you horror stories, which is not helpful at all.
No one wants to hear that.
No.
And she said to reach out to her. She is on Instagram at the movement with midwife. Is that the easiest way to contact you?
Yeah, probably. Yes.
Okay. So we'll link all this stuff in the show notes too, but just if you wanted to jot that down or give her a quick follow right now as we're going, please do that.
Yeah.
What is I just did a podcast about 3 bullshit things doctors tell you. So I want to know what you think is bullshit about pregnancy, birth. I mean, you could give me a couple since we're in postpartum, maybe one for each. I know I'm having you think on the spot.
Okay, let's start with postpartum because postpartum is actually like my absolute favorite. So Kegels are bullshit.
Oh yeah. Yeah, we talk about that here on the
I know
Mind
you
Body
do.
podcast.
And so you and I can definitely agree on that. But their Kegels are total bullshit and they create they create the same problem they think they're preventing. And how I describe it is like, we think, which I know that you've talked about this, we think that when something is leaking or dropping, like incontinence or prolapse, that the surrounding muscles are too weak. But the same thing eventually happens from muscles that are too tight, which is like doing Kegels is like doing bicep curls all day long. Looks like it's super simple, also really ineffective for as far as like moving with the entire body.
Amen, sister.
That would be my postpartum one. Birth. I think with birth, it's like there is not a timeline. There really isn't a timeline on, oh, this one, when your water breaks, that you need to go to the hospital right away.
Mm-hmm.
No, you don't actually. Even if there's no sign of labor outside of your membranes rupturing is what it's called. So rupture of membranes spontaneously rarely happens before labor starts. It's like less than 10% of the population that is your very first sign of labor. That actually typically happens during like pushing phase. And so when your water breaks, it's amniotic fluid. And so amniotic fluid actually replenishes itself. And so that's one of the reasons why you want to stay hydrated. But if you're having your baby in the hospital, you don't necessarily need to rush to the hospital unless your baby's premature. So like before 36 or 37 weeks. The window of time that I would be comfortable with, I guess, is like 18 to 24 hours at home. But the reason for that is their concern for risk of infection. Yet the first thing that they want to do when you get into the hospital is a vaginal exam, which increases your risk for infection. So, this is obviously different provider to provider, hospital to hospital, all those disclaimers, whatever. But I would say that that's one of like the major misconceptions is one, that your water should even break before you're in pushing phase. So you don't need to have your membranes ruptured at any point during labor to speed things up. And if they do break before any other sign of labor, it's not an emergency. And it's usually even less often is it like a huge gush as it is like a slow trickle. So that's what I would say about that. And then, pregnancy journey.
Like once you're pregnant, that whole time leading up to that.
I feel like for your listeners, though, this is going to be obvious, but there is actually no no evidence at all to support bed rest for anything.
That is a big one.
Isn't that crazy? None. But there's different things that come up, like with the placenta, things like that people are put on bed rest. And in my opinion, it actually, in some of the research shows, like it actually hinders things, because are there certain conditions where you want to take it easy? Yes. But taking it easy doesn't mean laying in bed in the hospital for weeks on end. Like mentally and physically, you're not setting yourself up for success when that's happening. And that has been in research for a long time. So we're just so far behind in clinical practice from what research shows. A really good book to read to learn more about that is called Exercising Through Your Pregnancy by Dr. James Clapp. It's super simple. It's full of research and it's super simple for doctors or providers and patients to read. So I like it because I can pick the research apart in it, but my patients also can understand it because some books you read are like super heavy. Yeah. So that's a good one to read for in that regard.
That's awesome. And yeah, I like that. I'm going to start. That's a good question. 3 bullshit things, because there's so much out there. And like you said, with the social media, you got to watch what you're taking in and make sure
there's a lot of fear mongering that happens in prenatal education too.
Instead of support, people are kind of like when people go to chiropractors and they get x-rays and they scare them into 100 visits by just circling their bones, and we can't put bones back in place. Thank you.
Right. Thank you. Yes.
Right. You. So speaking of that, I know you also still practice chiropractic, and you're able to walk through the full journey, pre-pregnancy, through pregnancy. Now you get to do birth and postpartum. Obviously, I can't do the birth, but I'm grateful to be part of the team, and I'm a very team-centric provider, and I think you should have a great team around you who knows what they're doing in their area and stays in their lane, and everyone the best of the best. And then you're just going to level up and get the edge and get what you want. But so some of the things that have come up for me, and I want to know what's come up for you. Some patients, like when I'm educating them, don't know some of these certain things or are scared some like certain these things. A question that comes up a lot is about the mucus plug. When it falls out, what's it mean? Can you go into that a little bit?
Yes. Oh my gosh, this has come up like 3 times today. So one of my boys, this is a little in the weeds story. One of my boys grabbed my phone and he was looking at my phone. And last week I had pictures of mucus plugs, pictures of a past retained placenta piece, and pictures of a golf ball sized clot. And so I was like, dude, you can't go on my phone without my permission, because there is private information in there, and you're going to see something that you're not going to want to see, and that they're not going to want you to see, especially if they can see the person's name. So I was like, stay out of my phone without my permission. Then this morning I had a chiropractic patient that said that she lost her mucus plug last Monday. And I was like, probably not, just based on timeline. Like usually if it's actually the loss of your mucus plug, labor will happen usually. Within like 3 or 4 days, labor would start, but your mucus plug can also regenerate. And towards the end, there's all sorts of like cervical changes happening. So everything like losing fluids left and right. Yeah. So the mucus plug though looks like a world's largest snot rocket with a tinge of like brown or pinkish. And that isn't uncommon to lose before labor starts. I would say maybe less than 50-50, but close. But sometimes people lose it right in like pushing phase of labor as well. Especially if they like dilate very quickly towards the end, because the mucus plug is within the cervix. So the cervix is closed and thick, and then it goes to completely thinned out and completely open. So obviously the mucus plug can't stay in there anymore once it's thinned out and completely open. It's just a matter of at what point is the cervix dilated enough that the mucus plug falls out, or you lose part of it. I mean, if you're going to have a cervical sweep or a vaginal exam or like anything like that agitates the cervix, then that can cause some spotting and might cause you to lose a little bit of that before you normally would, but your body can regenerate it.
Yeah. It's pretty crazy. And I feel like some of this stuff isn't talked about until like we're doing all their stuff, and I'm just randomly bringing it up, and I'm like, oh, your provider hasn't talked to you about this? Right. And another thing that comes up is, which if you haven't gone through birth before, you have no idea, but birthing the placenta. Like someone goes, I thought it would just fall out. Like, let's get into it. I mean, we do the real deal here. Like, we're going to talk about the shit.
Yes, I thought it would just fall out is probably everyone's like wish, right? So you have to birth the placenta. Postpartum doesn't start until you have the placenta. So baby's cranial bones are very mobile, like they overlap. And then that's how thank God they overlap and then they expand. Then it's like, we don't have to dilate to 15. We can just dilate to 10. And then after that, the contractions of the uterus are what help to like shear the placenta from the uterine wall. So if you've ever seen a placenta, I love them. The side of the placenta that's attached to the uterus is really rough. It's like not rough as in like texture wise, but like super bumpy, because that is so uterine wall and then placenta. And then the side that the baby is in, the sac, which is the bag that breaks when the membranes rupture, that is really smooth. So baby's housed in this like really smooth sac. So as the uterus is contracting, after baby is born, that oxytocin release continues. And then breastfeeding, I mean, if you're going to go like real full into it, babies will do a breast crawl. If they're placed on their mama's belly, they will like push their little feet and pull their little hands and like help cause uterine massage and uterine contractions, as well as if you put them at breast, then the feeding helps intensify those contractions. And so then usually I would say on average, the placenta releases anywhere from like 10 minutes to 30 minutes postpartum. And then it usually feels like a ton of pressure again in your pelvic floor, sometimes in your butt. And then it's just more of like gentle pushes that thankfully there's no bones, it's super soft. And then it like more plops out. There's occasionally, so I mentioned that I had a picture of a piece of retained placenta. Occasionally the uterine wall will hold on to a piece of placenta, which is less than ideal. It's not super common, but I do think that I think it happens more frequently with active management of the placenta instead of letting the placenta come when it's ready to come, like pulling on the cord too. Mm-hmm. So the cord, there's the placenta, the cord's attached to baby. I mean, 2 minutes is a minimum of waiting for the cord to stop pulsing. But a lot of people now are transitioning to waiting until the placenta is born and then cutting the cord. So
yeah, I love this. People are just getting more educated. And guys, you should be listening to this too. So send to your friends, send to your partners, husbands, whatever. Everyone needs to be educated more on this, and people just don't want to talk about it. But listen, everyone poops. So speaking of that, I can't tell you how many people have asked me, what's the likelihood I'm going to poop during birth?
95%.
So get over
I made that
people.
number up, but it seems like about 95%.
Yeah.
There's so much. So yeah. And in most of the time, I would say like 93 of that 95%, you got no clue that that's even happening. Mentally, you might be afraid of that. Like, oh, I don't want to poop in front of all the who we don't care. We're expecting it. We have a little fishnet if you're in the water, baby wipes if you're not, all that stuff. There's just so much pressure in that area. What I have to remind women of is like, don't hold that in, because if you hold that in, those are the same muscles that have to relax for the baby to come out. Mm-hmm. Just let it go. Yeah. I mean, almost every single time someone poops at least a little bit.
I mean, I feel better after I poop.
Right.
Why would you not want to?
And our bodies are so intelligent. So if you've had kids and you've gotten like super loose stools or even diarrhea, or like, why am I pooping all the time? And then all of a sudden within the next 2 days you have a baby, it's because your body is like getting ready for that. So all this stuff happens on purpose.
Yeah. And I'd much rather have diarrhea all day, every day than be constipated. I don't know about you.
I don't know about all day. I don't know about all day every day.
Yeah. Well, not all day. But you know what I mean? Like diarrhea or constipation, diarrhea every time.
Yeah. I would have to agree.
So what is your best advice that people might not be aware of that would help your pregnancy? You got pregnant. What for your health, for the baby's health? I don't know. What do you advise that people should invest in themselves or do?
Really sit down and think about the experience that you want to have, and not just be on this conveyor belt of like, oh, I have a positive test, so I need to schedule an appointment at the clinic. And look into your options and interview people and see what makes sense and see what resources are even nearby to you. And then do not stop asking questions until you understand, because you deserve to know what's going on in this whole entire experience. And I think that we just get like, it's so ingrained in us that you just like schedule the appointment at the clinic and then you're kind of on a conveyor belt of this is what's next. And you have options every single step of the way, like every single test, every single imaging, all of it. So if something comes up and you are surprised by it and not knowing what to do, take time. It's very rare that there's something that's an emergency, right? And then obviously you have to act accordingly. But in the moments when you have time to research more for yourself or ask questions, like the prenatal, what I love so much about prenatal education is it's actually preparing you for how you want to be as a parent. And like, whether it's you and your partner or husband or whatever, it's like you're practicing making big decisions together, and you're going to find yourself, you're like your circle getting a little bit smaller as far as like who you trust and who you go to for information. So think about that. Ask questions of the people that you trust and that are not that you want just only confirming information, but that are like-minded in regards of like priorities in their health. Pregnancy isn't a disease, and it can be a really beautiful experience, even in the hard times, as long as you have the right people on your team, which is what you mentioned before. So ask people that have been through it before, ask people that are like walking with you in the same area of the journey that you are, but pay attention to who you really feel peace around getting information from.
Yeah, I love that. And as
Yeah.
part of a team, how important do you think it is to have a chiro, someone specialized in all that, pelvic floor, the DNS, all that as part of your experience?
I think it's extremely important for two different, like, broad reasons. One, your physical body. Two, your spiritual or like metaphysical health, which people may think like, what does that have to do with anything? As women, especially, we have become so disconnected from our bodies, from like our neck down, but especially pelvic floor, areas of intimacy. I say there's so much societal shame or religious shame, like things that are just generations deep within us, that having someone care for your physical body is leaps and bounds in you really coming back into your body. And you have to be able to practice that during birth, right? And it's like this, our pelvis is our powerhouse, it's our foundation. And so when you're going through pregnancy, so much of that is shifting and changing. There's another human inside of your human. And then postpartum, like there's this whole entire 10 months that all of this happens during pregnancy. And all of our emphasis, like think about how many chiropractors do you know that are postpartum chiropractors? No, but there's prenatal chiropractors everywhere.
Mm-hmm.
But prenatal is 10 months. Postpartum is this long, and it happens in like 24 hours, right?
Mm-hmm.
We go from pregnant to giving birth in months, and we go from pregnant to postpartum in hours. And the postpartum piece is totally underserved.
Yep.
I think that it's getting better, but that's probably because you and I have surrounded ourselves with people that like care a lot about that, right?
Yeah. And I mean, I think setting someone up for success in postpartum, like, what do you think we can take off your plate? And like setting up that team once again to support.
Yeah. And I used to see, I was just talking about this too. I see people, women, way more frequently postpartum than I used to.
Mm-hmm.
Because postpartum is like such an experience to navigate. And our goal is, of course, to help you with your core and your pelvic floor and your posture when you're nursing and or carrying baby and all of those things. But that's not the only stuff that comes up in the appointments. Like probably your baby's not sleeping through the night. You're exhausted. You've got questions about other things. You're trying to like learn all of this in addition to learning about this new human. And so it's never linear. It's always a bumpy road. And that doesn't mean it has to be hard, but it is bumpy. And so you need people there for your support. So I have found in the last like few years, I have a pretty like standard care plan that I use for postpartum now as a minimum. And I see way better outcomes for women with their long-term core and pelvic floor care. But that also like they need to be heard, and that's not happening in the hospital with their midwives and OBs because there's so much demand on those providers and they don't have the time, and they also aren't trained. We have to remember that they are not the musculoskeletal experts.
Exactly. And sometimes, I mean, I'm sure it happens on your table too. Just let it out. Just cry. I'm safe. I can take it. Like,
Mm-hmm.
I'm here to help you and I'm here to listen. And we're going to meet you where you're at. So what in that postpartum care plan, like recommendations?
So we start the postpartum care plan at 2 weeks postpartum. We will see a patient before that, but we prefer to see them in their home if it's before that, because there's so many appointments that they're supposed to get to for weight checks. And like, honestly, a lot of it's bullshit unless there's an actual concern with baby, because they're not really checking in on mom during those visits anyway. So we'll come to you, or you start 2 weeks postpartum weekly. Then we're starting with breath work, diaphragm release, learning all that stuff. Sometimes scar tissue work if it was a C-section, scar tissue work, teaching scar tissue work if there was any vaginal tearing, and then starting to work through the functional progression in sequence, even if we've been through it before, because it's like relearning your body postpartum. So just learning how to stabilize, all those things. And then we like to see people start a movement practice again, typically between like 6 to 8 to 12 weeks. It depends on their birth story, right?
Right.
And our favorite is to make sure that they have some sort of strength training involved in that. But ultimately, and I would imagine you're the same, Audra, as like, we want to keep you moving the way that you love to move.
Absolutely.
And it's few and far between that I'll actually recommend someone completely stop a practice. But if it's hurting them, then we just say like, okay, how can we get this stimulus from some other way? But yeah, that's to your point with the crying, it's like, okay, so when I came back from the D course in Prague in 2013, or no, that was the first time I went to Prague. So it wasn't even a D course. When I came back from Prague in 2013 is when I created the functional progression based on DNS. There wasn't all the exercise courses and things at that time. So I really needed something to utilize with my patients that they would actually take home. What I didn't anticipate is the amount of tears, because people were getting familiar with their body again. And that's hard. It's like, first of all, even realizing that you were disconnected from all of that in the first place, and then starting to give yourself grace and move through that. So yeah, a lot of that comes up again postpartum.
Yeah. Oh my gosh, I love this. And I love talking about all these spicy subjects that I know are not normally talked about. So I think we're going to have to do a part 2 if you'd like to come back.
Of course.
So DM me at Dr. Audra Lance with more of your questions for us to talk about and dive deeper into. You can listen to Dr. Erica on her own podcast, The Womb Woman. And she, if you want to dive more into this as an OB, as a midwife, as a chiro, as a PT, as a doula, she is working on a course coming out that it'll be fire. So stay tuned for that. And I just want to thank you so much for coming on. And I can't wait till you come back.
Thanks for having me.
Toodaloo, butthole breathers.